I'm Nick Chamberlain. I'm the Chief Executive of Northland DHB. We've got the Health Services Plan because I believe we have to have a planned approach and we need to change. Basically, the current system is performing to a reasonable level, but it's not going to be good enough for the future and the challenges that we have. Acute demand on our hospital services is outstripping our capacity to fund those. Demand within the community sector is really significant. Probably most importantly though, we're seeing disturbing trends in some of our health outcomes, and health can only influence perhaps about 30% of health. And some of the other major determinants of health, that what we call the social determinants around education, poverty, housing, etc., are much greater determinants of health. And we can only do so much to affect them. We can work intersectorally, but we can't on our own make those changes. So we need to work together as a sector, and so this health service plan is about working together. It's got a framework around it called the Triple Aim, and so we're working on the population's health as well as improving the quality and safety of our services and improving access to services, so that's the patient experience, and also ensuring that we're delivering high value services that are sustainable, and so we need to make sure that all of our services are cost effective. And so it's that planned approach, and it's not only looking at a 5-year horizon, but it's moving out to that 20 years so that we can plan to deliver over the next significant period when those challenges will occur. If we don't do that, our services will not be sustainable. We'll be having to try and build extra hospitals that we can't afford, and I'm pretty sure over a period of time we'll start to run deficits. So we really need to do this. It needs to be absolutely a significant change, and everybody needs to be involved. One of the key drivers of the health service plan, and one of the areas that we're really looking to change, is the way we do things currently, and I think that needs to be challenged in all areas, and both in the hospital and in primary care. So in the community and hospitals, there are ways to improve things, but basically what we need to be doing is focusing more on population health, keeping people well, keeping them out of hospital, and with that comes a need to look at the models of care in primary care. There are quite a few opportunities to look at the current facilities that we have and ensure, in some cases, groups of GPs are working together in what are called integrated family healthcare centres. In some areas they will be aligned to a district hospital, and so we are working in Kawakawa and Dargaville at the moment around ensuring that there's really clear integration both across the services in primary care but also within the hospitals themselves. And with that, larger centres comes opportunities to change the way things are being done, the opportunity to utilise nurses, practice assistants, pharmacists, etc. And with that comes an opportunity to ensure that the GPs are working at the top of their scope as well, and not working on areas that they could perhaps better pass on to one of their other staff. So the models of care work is critical to us, I think, achieving the sort of sustainable change that we need.